Hi, I'm here to inform you about cancer. Cancer is one of the deadliest diagnoses that you can have. 1 out of 2 men and 1 out of 3 women get diagnosed with cancer. Prostate cancer is one of the most common cancers in men, and breast cancer is one of the most common cancers in women. Cancer not only affects the person diagnosed, but it also affects the family and friends surrounding them. Did you know that cancer is painless? Today I plan on talking about the different types of treatments for cancer and the effects that it has on not only the person but the family. So let's talk about how it's not the tumor of the cancer that causes the pain. Your pain is caused by the tumor pressing down on the bones, the nerves, or other organs in your body. Your pain level also depends on the stage of your cancer. The higher the stage, the larger the tumor is. The larger the tumor is, the most likely that you'll have that tumor pressing on the bones, the nerves, or other organs. Your pain level also depends on the location of the tumor. The location of the tumor causes, in certain areas, will cause more pain for people, and your pain level may be caused by whether or not your cancer or the treatment has caused any nerve damage. Let's now talk about the different kinds of treatments. First of all, you need to know how invasive your cancer is, and is your cancer treatable? The different types of treatment for cancer is oral medication, chemotherapy and radiation. Not everybody will need the same type of treatment for cancer. Some patients can do all the cycles that are necessary for their chemotherapy regimen that the doctor orders for them. Other patients may not be able to complete the whole cycle of chemotherapy. Some patients have complications, other patients don't. It just varies on each person, is different, and some patients may not need all of the chemotherapy because their cancer does shrink with just a small amount of chemo, and they don't have to complete their full cycle of chemotherapy. There's so many different reasons why you can change the regimen for chemo. The medications are different for each cancer. Not everyone will have the same treatment plan. Others may not be able to handle treatment and may have to stop the chemo or the radiation. But nowadays, there's so many different capabilities and so many different options for patients that they're always able to help someone with the complications. Now, before they didn't have the studies that they do now, they're able to test for certain cancers. You can test the tumor gene, and you're able to test after chemo if that gene will return and that patient's cancer is most likely to come back. Before they didn't have those capabilities. Now we're able to test for that. That is one option for patients with cancer, which is very good. The other option is you can test the gene and see if anybody in your family will end up getting diagnosed with cancer. As you know, everyone is affected in a different way from cancer. Not only does it affect the person diagnosed with cancer, but it also affects the families surrounding that person. Some of the family members may not know how to cope with someone who has cancer. There is a lot of support groups out there to help them. When you are diagnosed with cancer and you have to go through chemotherapy, a lot of patients become weak. They lose their hair, they lose weight, and a lot of families don't know how to cope with that. The patients don't know how to cope with that. There's a lot of support groups out there to help those patients. A lot of families don't have the funding for chemotherapy nor for the doctor's visits. That does become very expensive. There's also funds out there for that, and there's also foundations out there for that to help you to afford those treatments. So keep in mind, don't be discouraged if you do get diagnosed with cancer, because there is help out there with those expenses. Whether you have insurance or whether you don't have insurance, there's funding out there for everyone. Now let's sum up things, and now that you can see that all cancers are different and that it affects everyone in a different way. People not only have the same treatments, some people will survive, others don't survive from cancer. There's not a cure for cancer yet, but we do have the ability to keep a person who's been diagnosed with cancer, give them a longer lifespan to live than before, with the ability to remove the cancerous tumor, the ability to give them the chemotherapy and radiation treatment. We give them a longer lifespan, and those treatment options are there to help them. And it's also very important after you're done with treatment to stay healthy, follow a good diet, also follow up with your oncologist, and follow up regularly with the doctor and the exams to make sure that your cancer does not come back. Here I have a picture of a cancer survivor and her husband. Her name is Beth and his name is Raul. Beth and Raul Gomez. She was diagnosed with cancer in 2008 with rectal colon cancer. Beth had no symptoms, had no pain. She was just having a little bit of rectal bleeding. She went to her doctor for a checkup for the rectal bleeding, and due to her family history of her grandfather and mother of having rectal cancer, he decided to do a colonoscopy. And upon that colonoscopy, they found that Beth had a rectal mass, which needed to have surgery right away. They did the surgery. Pathology came back that Beth had cancer. Beth had to undergo chemotherapy and is now in remission. And Beth follows up with her oncologist every 6 months and does have a colonoscopy screening every year just to make sure her cancer doesn't come back. Now in Beth's case, she is a survivor and she didn't have any pain because cancer is painless. Goes to show, you never know, you just need to be cautious, and if you have just the littlest symptoms, especially with the family history, always be prepared and always get checked up. Even after, especially after you've been diagnosed, stay healthy, follow the regimens, and keep in contact with your doctors. Thank you.